Good to go? All right. Good morning, everyone. I'm Seth Rosenstein. I'm a councilman here in Glen Rock. In towns like ours, families work hard to make ends meet, balancing the cost of groceries, childcare, and health care. The Affordable Care Act premium tax credits have made a real difference for our neighbors, helping Glen Rock families afford coverage and get the care they need. We're lucky to have Congressman Josh Gottheimer here, who understands that and who's fighting every day to lower costs and protect affordable health care for New Jersey families. Congressman Josh Gottheimer has always had Glen Rock's back, and we're fighting, and we're grateful that he's here back today fighting for that. Please welcome me in welcoming Josh back to Glen Rock.
Yeah. Thank you very much. Thank you so much. But before I come up, and I really appreciate those comments, Councilman, and thanks for your leadership in this great community. I do want to call up somebody who is, we've got a few unbelievable champions here, you'll hear from them, but I first want to turn to our Assemblywoman who represents us along with Assemblyman Tully here in this area so ably, is such a champion of families and children and people who work hard every single day, and we're fighting to make sure they have health care for their families, and also food on the table. She just does an incredible job. Not only is she always running, Jim can attest to the fact that you see her on the street running everywhere in the county. Jim's running in to fight a fire. He drives the truck past Lisa, who's also running to the fire herself. She does an amazing job. She is a great friend of all of us, and I want to welcome Lisa Swing.
Thank you. Jim, we'll have to stage that.
Yes, for sure.
Good morning, everyone. Right now, our federal government is barreling towards a crucial deadline regarding the Affordable Care Act premium tax credits, especially with open enrollment right around the corner. Throughout the years, these subsidies have helped bring health coverage within reach for millions of Americans. Now, they are at risk of expiring, and other states are already seeing the consequences. Unless these subsidies are extended, premiums here in New Jersey are projected to skyrocket by 174%. Let me repeat that, 174%. Everywhere, families in New Jersey and across the country are already stretched thin by rising costs for childcare, utilities, and everyday essentials. If these tax credits lapse without a clear path forward, many New Jerseyans will face impossible choices: paying for insurance they can't afford, settling for less comprehensive plans with higher deductibles, or going without coverage altogether, causing irreparable harm to our working families, our small businesses, and our economy. It must be emphasized that this is not and should not be a partisan issue. Over a dozen Republican lawmakers have also called for these enhanced ACA tax credits to be extended. The health of our nation cannot be used as a bargaining chip that can be gambled away cavalierly. This isn't about politics or party lines. It's about protecting our residents from devastating premium hikes, maintaining the stability of our healthcare system, and keeping each and every one of our citizens healthy and out of debt. Today, I join with my colleagues in calling on the federal government to extend these vital tax credits as soon as possible. Lives literally depend on it. Thank you.
Excellent. Thank you so much. I now want to call on Karen McKeon, who's here, to talk to us a little bit about why these issues matter in the healthcare community so much, why it's so important that we take action on all fronts to help people get people's premiums down and to help make healthcare more affordable. Karen?
Thank you, Congressman. Thank you, Assemblywoman, and all of our elected leaders here today. I'm Carrie McKean-Kelly. I'm the Vice President of Communications and Member Services at the New Jersey Hospital Association. We're a nonprofit association with 400 members across New Jersey, and not just hospitals, the full continuum of healthcare, nursing home, assisted living, home health, hospice, and others. And together, we are committed to making sure all New Jerseyans have access to the quality health care they need. We are so grateful for the leadership of Congressman Gottheimer for really shining a spotlight on this issue of health insurance affordability. Last year, more than 500,000 New Jerseyans got their health insurance through the Get Covered NJ online marketplace, and that was something to celebrate. This year, those same individuals and families are facing these astronomical premium hikes if we are not able to preserve the enhanced subsidies that help them afford the insurance they need. At NJHA, our mission is to improve the health of New Jerseyans, and health insurance is fundamental to that. Number one, it's the gateway to access to care, and especially those preventative services like checkups and health screenings and vaccinations and the medications you need to manage your chronic conditions. Those are vital for health and wellness for New Jerseyans. Health insurance also protects families from large medical bills if they have a serious injury or some kind of chronic, very acute health condition. And most of all, health insurance just provides peace of mind for individuals, for parents, for families, knowing that their loved ones are covered. But today we bring an added message to New Jerseyans. Amid all the uncertainty this open enrollment period, we encourage them, don't be discouraged from exploring your options in the health insurance marketplace. As Congressman Gottheimer and these advocates continue to fight the good fight to preserve the enhanced premium subsidies, there is still some financial assistance available from other sources. There are a wide variety of plans available to give individuals many options, and there is help to sort through it all. NJHA has a team of health navigators who are especially trained to support and assist in going through the marketplace and seeing what you're eligible for. They're active in community locations across New Jersey to provide personalized, confidential, free assistance to New Jersey individuals and families. They're also available virtually. So to connect with them, just go to www.njha.com/covernj. They are just a Zoom or a phone call or an email away. Whether it's our delegation in DC or our navigators just sitting down one-on-one with a New Jersey family, we won't rest until all New Jerseyans can get access to a health insurance plan that not only meets their needs, but meets their budget. So thank you very much.
Thank you so much. Now I want to call up someone who's a great friend to our county and our state, who is someone who cares deeply on every front and who has been an endless champion and a great friend to all of us. I joke around that he runs into fires, but it's not just an actual fire. He runs into anywhere where we have a crisis. And right now we obviously have a crisis on our hands with healthcare, with food, and I know Jim Tedesco will step up and be there, our great county executive, Jim Tedesco.
Thank you, sir. Good morning, everyone. First, I want to thank Congressman Josh Gottheimer for his leadership and his action to protect affordable health care for families in New Jersey. Josh has been sounding the alarm for months.
Is that the alarm?
There it is. Urging his colleagues in Washington to act before it's too late. And once again, he's standing up for the people that he represents. It's real simple. The reality is simple and alarming. Thousands of residents here in New Jersey and millions across the country are at risk of losing their health care. If Congress doesn't extend these critical Affordable Care Act premium tax credits, families will see their premiums skyrocket, and many will have to choose between paying for expensive premiums or, unfortunately, foregoing health coverage. We're standing in front of Rockridge Pharmacy. The proprietor is here with us. And this isn't just about the people's health care. This is about the effect it's going to have on a small business right here in downtown Glen Rock. If people can't get to doctors, if people can't get the appropriate health care, they're not going to be able to get the medications they need and the services they need. That will directly affect these types of small businesses. So it's not just the individual that's being hurt and the families that are being hurt, but this is affecting everyone, even here in downtown Glen Rock. And let's be clear about how we got here. Republicans, who control all three branches of the government, passed the big, terrible bill, which was deliberately written to make health care more expensive for hardworking Americans. This same crowd that's indifferent to kicking our most vulnerable neighbors off programs like SNAP and WIC, leaving families hungry. Here in Bergen County, 25,000 families, 46,000 individuals will lose their SNAP benefits tomorrow. Children without essential nutrition, having hunger in their belly, all the while to protect tax breaks for the wealthy few. It's shameless, it's reckless, and it's wrong. Here in Bergen County, we see every day what happens when government works for people, when we invest in our residents, not abandon them. I urge people to continue to register, to continue to go online and seek the services that they so much deserve. Congressman Gottheimer is doing exactly that, fighting to reopen our government, fighting to keep health care affordable, and fighting to make sure no family is left behind. Josh, thank you for being in this fight for all of us. Bergen County stands with you and with every family that deserves affordable, reliable health care and a government that works as hard as they do for the people. Thank you.
Thanks so much, Jim.
Not gonna hear you over the bells.
I'll wait 1 second for the train to go by. First, I want to thank the county executive again for his leadership. I know he's doing everything he can, along with our commissioners, to help get this problem addressed. Secondly, I do want to thank Vishnu sorry, Vishnu, we'll wait till the train. Just give everyone a second if you don't mind. They feel the same way in the train. So, secondly, I want to thank Vishnu for what he does in our community, in this great establishment. This is the kind of pharmacy, frankly, we need more of, right? Great community pharmacies that take care of people, the kind of service when you walk in, they know, and Jim and I were just talking about this a second ago, when you walk in, they know you, they look after you, they take care of you, and they do it year in and year out. And I just want to thank you, Vishnu, for what you do here and for running a business in this great community. I know Councilman appreciates it. I know it's a great town, and we're very lucky and appreciate you letting us stand out front. You heard me talk about carrying the Assemblywoman. They're all phenomenal leaders in a fight that is critical. You know, every day, parents look to places like this one for advice because they show up and their kids are sick or they need help, and they honestly, what's wrong? Oh, I forgot somebody. Sorry. I'm so sorry. Sorry. I forgot to let you speak. Sorry. Did I screw up and forget to let somebody speak? Thank you so much. I apologize. Sorry. Please, go ahead. Fisher, I'm sorry about that.
That's okay. You're good. You were doing it, Wes. You were doing well.
Jim got me so revved up. What do you want from me?
No, well, thank you.
Sorry,
No, you're good.
Sorry.
My name is Justin Zimmerman. I'm the commissioner
Sorry,
of the
Justin.
Department of Banking and Insurance.
You know, it's Cheryl's last day, and so Cheryl forgot to put your name down.
No, you're good.
Now, by the way, I do want to pause and just say Cheryl's the best. It is her last day today. While we're pausing for a second, She's been unbelievable. I wouldn't be able to run my office without her. The people have been being taken care of. And now she's going and doing a great job in the county, and I'm very grateful to share her. Sorry.
Thank you again, Congressman. My name is Justin Zimmerman. I'm the Commissioner of the Department of Banking and Insurance. We run Get Covered New Jersey, the state's official health insurance marketplace where consumers will be shopping come tomorrow. So I also want to thank the Congressman as well as the other members of the New Jersey's congressional delegation who have been working to ensure that health care continues to remain affordable in our state and beyond. Get Covered New Jersey, as I mentioned, is our state's official health insurance marketplace. It was created by New Jerseyans for New Jerseyans at a time when the Affordable Care Act was under attack by the federal government. We created our own state-based exchange to increase access to affordable, quality health coverage for everyone in this state. And since we launched in 2020, we have not only broken down previous barriers to coverage created by the federal government, but the state's commitment to provide this quality, affordable health coverage has led to an increase in marketplace enrollment by 108%. The doubling of our enrollment in 5 years means that we are now providing health coverage to over 500,000 New Jerseyans, more than 3/4 of whom have only enrolled in coverage after the enhanced premium tax credits took effect. In Bergen County alone, there are 50,000 residents who are enrolled in coverage through Get Covered New Jersey. Unfortunately, we're all here this morning because of congressional inaction to renew these enhanced premium tax credits. And because of this inaction, consumers will be faced with higher health insurance premiums for the upcoming year. Truth be told, if Congress does not act, we are significantly concerned that many households will be forced to choose a health plan that with lesser coverage than they have today, or choose no coverage at all. Those affected are our neighbors, working parents, small businesses, gig workers, early retirees, middle-income families of all ages and of all backgrounds. They drive our local economies and make communities throughout our state, such as Glen Rock, thrive. If Congress does not act, New Jersey will lose more than $500 million in federal tax assistance, and health insurance costs will surge for enrollees. I'd like to take just a minute to highlight a couple of real-world examples of New Jersey families from right here in Bergen County who will see some of the most dramatic cost increases. A couple in their early 60s with a household income of over $90,000 will see an annual premium increase of $24,644. Their new premiums will be over $30,000 annually and consume 33% of their income. A family of four, again here in Bergen County, with a household income of $149,000 will see an annual premium increase of $22,539. Their premiums will be over $33,500 annually and will consume 22% of their income. While Washington is deadlocked, open enrollment for Get Covered New Jersey begins tomorrow, November 1st. And as consumers review their plan options for next year, we want everyone to know that Get Covered New Jersey is here to help them stay covered. While we wait for Congress to act, New Jersey is doing its part. Through dedicated state funds, we estimate that in total, consumers will receive $215 million in state subsidies that will directly lower premiums and make health coverage more affordable. It's important to note that while a large portion of federal assistance is expiring, there still is federal financial help available to those that qualify, and that 8 in 10 residents will qualify for either state, federal, or both financial assistances. If you are enrolling for the first time with us, or you have enrolled since we've launched, everyone should know that we have free enrollment assistance in communities across the state and in every county. Our network of navigators and brokers are trained professionals who will help guide you through the enrollment process. And you can find them at the We Help section of our website at getcovered.nj.gov. As in previous years, throughout open enrollment, we will have outreach where residents can enroll or just stop by and talk to us throughout the state in malls, and for the first time this year, will be in local supermarkets. While open enrollment runs from November 1st, tomorrow, through January 31st, we're asking that everyone shop and compare plans and pricing as early as possible to ensure they find the best fit for themselves and their families. We want everyone to know that they can find comprehensive coverage with plans that cover preventative services, emergency services, prescription drugs, prenatal and pediatric care, and more, all at Get Covered New Jersey. And most importantly, no one can be denied coverage if they have a pre-existing condition. While the federal government is shut down, New Jersey is still hard at work, and we're here to help consumers navigate the federal changes to ensure they stay covered by finding the right plan that fits their needs. With open enrollment only hours away, I can assure you that it is not too late for Congress to take action to lower the cost of health coverage, and that the state and my department stand ready to act as quickly as possible at any time if Congress takes action to ensure New Jersey consumers continue to have access to quality, affordable health insurance with the enhanced premium tax credits. So thank you again, Congressman. Thank you again, everyone, for your advocacy.
Thank you. Thanks. Commissioner, thank you for speaking. I would add to it that, just as a reminder, the Republicans control the House, the Senate, and the White House.
I wasn't speaking about you, Tom.
So, but I think it's really important people understand, it's very important people understand that a lot of us are very hard at work right now. I was in Washington this week, as I've been every week since the shutdown, focused on working with Democrats and Republicans in the House and the Senate to get the government reopened and to make sure that we get premiums down, to help Americans, to help people in Jersey, make sure they deal with, when they go to any site to get health care coverage, when the site's open on November 1st tomorrow and open enrollment starts, and they see their plans, they understand we're doing everything we can to get their premiums down. And the best way to do that, and we've been calling for this, is let's make it simple. Let's vote immediately on extending the ACA tax credits to reduce premiums. That's the best way to get premiums down for people and to deal with what I worry about every single hour right now. Families seeing these huge increases in their premiums and either changing their plans because of it and getting something that doesn't cover them, that they can't go to a pharmacy and get what they need, or worse, that they drop their health care altogether. And I know that for a lot of families, that's a decision they're having to make right now. And on top of that, when this White House refuses to come to the negotiating table and not just talk about the ACA premiums, but also, and getting premiums down for families, but also reopening the government so that we can get SNAP benefits, food assistance for families who need it. So people are having to choose literally no prescription drug coverage, no health care coverage, and they're not going to get any food. And I think about that, and I'm sure, like all of you, that's what it kills us. It's why we're here. It's why we're here today, to make sure people can actually get the food they need for their kids and put on the table, and that they're able to get the health care they need. What's going on right now in Washington on Halloween isn't a treat for families, but instead you've got people stuffing higher insurance premiums and taking food right out of their Halloween goodie bags. That's what's going on this Halloween. Open enrollment does begin tomorrow, and Jersey families will see firsthand how their insurance premiums will be going up at the end of the year if we don't get the ACA healthcare premium tax credits extended, because they expire at the end of this year, meaning these premiums will go up next year. That's just a couple months away. And people are choosing, starting tomorrow, their healthcare coverage, the plans they're picking. For 466,000 people across New Jersey, including here in northern New Jersey, who rely on the ACA premium tax credits, or, as we said, Obamacare, healthcare.gov, Get Covered New Jersey. It's really frightening, these numbers. On average, put aside if we get these ACA premium tax credits extended, on average, people's premiums will go up nearly 17% across the state of New Jersey, regardless if you're on the ACA premiums. Nearly 17%. That's for everybody. In 1 year, that's how much premiums are set to go up. This is after they went up about 6% last year. If people who are on the ACA and use the ACA, if we don't get these tax credits agreed to and extended, they will see an average health insurance premium increase of 175%. It's like almost hard to believe, so I want to say it again. On average, everyone's premiums are going up about 17%, everybody. If you rely on healthcare.gov, on the ACA, on the state's plan, on average, the premium increases will go up 175% in 1 year. For a family of 4 in Jersey, as you heard, on average, you're talking about over $20,000 increase in a year for premiums, for people with health insurance premiums. How are people supposed to be able to afford that? As it is, they're struggling to pay for food, deal with the Trump tariffs, deal with higher energy bills, and now you're going to club people with these health insurance premium increases of 175%. How are people supposed to make that work? Seniors are going to see an average increase of nearly $2,000 if this doesn't get done. I know how people are going to be able to go to the hospital if they can't afford this, or go to the doctor, or get their prescriptions filled. 4 million people across the country will lose their health care altogether and won't be able to afford it. About nearly 200,000 in Jersey, we predict, will just say, I can't afford this, I just won't have any health insurance at all. It especially affects younger people, right, who will say, oh, I don't need health insurance coverage at all, and if they have it now, may drop it altogether as well. We want people to have access to health care, but I know that 85% of hardworking Jersey families literally worry about this every day, and I hear about it wherever I go. They're talking to me about it. So I'm so proud to stand with these advocates here, with New Jersey Hospital Association, with these incredible elected officials and public servants who do such an amazing job, with the commissioner in New Jersey. Let me also be clear. In the U.S., healthcare spending increased about 8% last year, as I said. I said it was 6, actually 8%. And Jersey families already pay 15% more than the national average. People shouldn't have to choose between food and getting health insurance. And by the way, as Jim and Lisa and others have talked about, we also have another urgent problem that will hurt thousands of children and families across our state. As of tomorrow, SNAP benefits will lapse. What does that mean? Food that so many families rely on to put on their table every single week to feed them. Feed their kids, feed their parents who may be older and are struggling. Here in Bergen and Passaic, Sussex counties, and across the entire state, these benefits will disappear altogether, gone. More than 800,000 people in New Jersey, nearly 42 million people around the country are currently at risk of losing food assistance they need. This is tomorrow. Tomorrow. That's why all these food banks are setting up all over the state to help people, including all over Bergen County. I know Jim's been doing it. Our commissioners have been doing it. I spoke to Tracy Zur, our commissioner, a minute ago. They have, I think, 40 towns that are setting up places where you can go donate. And I really encourage people, if they can, to go help. Community Food Bank's doing an amazing job. Greater Center for Food Action, Demarest Farms, Table to Table. All these organizations, Wakefern, which are all the ShopRites, have stepped up and are doing an amazing job. This isn't some Halloween trick. This is real. This is what happens when a president won't sit down at the negotiating table and figure out a way to work with us to get the government open. That's all we're asking for, to try to sit down and figure this out. I've been talking again to Democrats and Republicans in the House and the Senate all week, last week, the week before. But you know, you got a president who said yes last night. Well, forget it. You shouldn't sit at the negotiating table. That's literally what he said. I don't understand that. How could you do that when people are hurting the way they are? And again, so many people are stepping up and donating. And if you can help your neighbors and your loved ones and your friends and give a little food to help them out. Even if we get this solved today, it's going to take about 10 days, we think, to get this turned on. I spoke to the governor a minute ago. I know he's looking at every single option right now to be able to help people with emergency support for food, to deal with SNAP crisis that we're dealing with. I've been calling on the Speaker of the House to bring us back into session. You talk about, Commissioner, how frustrating this is that with what's going on in Washington. Literally, the Speaker of the House, who has the keys to turning on or off the House of Representatives, to let us come back and work together, because the unfortunately, Republican legislators haven't gone down in weeks. Many of us have, but they haven't. to actually get it done, we're going to have to go back in session. The Speaker of the House can bring us back. He won't open the building up. It's ridiculous to get a bipartisan deal done, to get food assistance done, to get the ACA tax credits from expiring. And I don't get it. And Trump won't allow it. It's not the art of the deal. It's the art of stupidity. And this was after, and I think Jim, you pointed out, the one big, beautiful bill. I call it the big effed up bill. A little more Jersey than you on that one. Because it launched a direct assault on Medicaid, Medicare, and Jersey families. Not to mention tariff increases that are going on in everything. So people are dealing with higher prices on everything. They're struggling. And it's hurting people here in Glen Rock and around the state. It's not exactly making America great again. As a bipartisan problem solver, I'm announcing new action today to help get health insurance premiums down and help families who are relying on SNAP. First, with families starting to enroll in insurance plans tomorrow, and many are seeing these rising costs firsthand, I'm launching a new portal to hear directly from people in Jersey. Gottheimer.house.gov/shutdown survey. Tell me how the shutdown is affecting your health care, the food you're able to put on your table. How's it affecting you and your family and your children? These aren't just numbers, these are people. They're parents, they're kids, they're seniors. How is this affecting you? Your ability to go get your prescription filled, your ability to go see a doctor, go get what you need. I'm going to send a letter to congressional leadership in the House and the Senate with the responses you all give me. I want them to understand these are not statistics. These are real families who are hurting. We just can't let this happen. I'm also asking the Trump administration to use the emergency funds they have that we gave them for SNAP contingency dollars. They have nearly $6 billion they could put to work today for emergency purposes like this one. The Department of Agriculture, at USDA, to put it to work to help SNAP. These are emergency dollars they could get out to states today. They've chosen not to use these emergency dollars. They're sitting on their hands. I don't understand it. So I'm asking the president, please, do the right thing here. Let these dollars go to help out while we're getting the government back open. They could do it today and get money to SNAP to help this program and help feed our families. That's why we gave Congress these funds for emergencies. So use these emergencies. We did it for WIC. We can't just sit around and not do it for SNAP. Finally, I'm calling on the president to have a meeting with many of us, to sit down. I've asked him now many days. I will go there today. Trick or treat. I'll dress up however he wants me to in whatever costume that he wants. But I'll tell you how I'm going to dress up as a congressman and say I'm here, knock on the door and say, let us sit down and figure this out. We've negotiated together in the past to get the government open, to deal with challenges like this one. We can do this. We can help get SNAP resources and food to children and to families, and we can deal with this healthcare crisis and get premiums down and get a vote on the Affordable Care Act, extension for these tax credits to help families pay for these premiums. So I'm asking the president, please, sit down with us today. There's no need to point fingers here at anybody. We can work together as we have in the past to get this done. Let's vote on this today. I've asked congressional leadership to do the same thing. I will keep working day in and day out. It's good for our country. It's good for families. It's what we need to do for this state and for our great country. There's nothing partisan about making sure that our families and our children have health care. There's nothing partisan about making sure that our children are fed. It breaks my heart when I think that next week, when we've got days off in our public schools for teachers' convention, there's going to be kids that have no food. I don't know what's going to happen. They're not going to have school breakfast or school lunch. They're not going to have meals at home. What are we going to do to feed these kids? I know the governor's working overtime. I know Jim and our county executive is working overtime with our commissioners. I know Lisa is working overtime in the state to figure this out. We all got to work together with the commissioner and the governor and others to make sure we deliver here for our families. We live in the greatest state and the greatest country in the world. If we work together, our best days will be